Hi, in this video I'm going to show you how to take a blood pressure. And of course for a blood pressure you're going to need your stethoscope and you're going to need your blood pressure cuff. Before you begin, make sure to take a look at your blood pressure cuff gauge and make sure that the gauge is calibrated. To do that, you're going to take a look at the arrow on the cuff, on the gauge, and make sure that the arrow is pointed to that little square at the very bottom. If it's pointed to the square at the bottom, then you know it's calibrated and ready to use. Also, it's a good idea to always inspect your tubing and your cuff to make sure it's not torn. The first thing that I want you to consider is the size of the patient's arm. That's real important because this is not a one-size-fits-all cuff. If the patient's arm is narrow, like as in a child or an infant, maybe an elder adult, you're going to probably go down to a child cuff. Okay? If you have a larger adult, the stethoscope and blood pressure cuff that we gave you, the blood pressure cuff may not work. You might have to go to the large adult cuff. So always consider the size of the patient's arm. Okay, the first thing I want you to do is to establish where the brachial artery is. And the brachial artery runs on the inside of the arm, toward the patient's body. Not out here, but it's actually in here. And you're going to take two fingers and you're going to palpate on the inside of the arm, right above the elbow. You're going to palpate for the patient's brachial pulse. Once you find that pulse, you're actually ready to put your cuff on. Okay? Now, if you cannot find the pulse, I don't want you to guess. Okay? I want you to go to the other arm and see if you can find a pulse on that side. If you're not sure, then just ask. Sometimes that pulse can be hard to find. And I want to make sure that you find it. And you'll find out why it's so important to know exactly where that pulse is. Okay, so the next thing is to put the cuff on. You'll notice that your cuff has a patch, a white patch, and that patch has two arrows, the left arm arrow and the right arm arrow. Okay? Now those arrows are designed to line up with the brachial pulse of either the left arm or the right arm, and this happens to be Justin's right arm. So we're going to place the cuff into his arm, and we're going to actually line that right arm arrow to where we felt that brachial pulse. Okay? That pulse, remember, is on the inside of the arm, closest to the body, not out here. Please don't let me catch you looking for a pulse on the outside of the arm. Okay? So being really careful with the gauge. You don't want to knock your gauge around. We're going to have the patient come toward us. We're going to place the cuff around the arm with that arrow pointing to the brachial artery. And I want you to put the cuff on tight enough to where you can still slip two fingers between the cuff and the arm, but not your entire hand. So it has to be on at the right position with the right amount of tightness. You can't just put it on anyway. Okay, so now that the cuff is on, it's above the elbow, it's on, the arrow is lined up. I can now take my gauge and clip it to the little clip there, or if you want to, you can just clip it to the patient's sleeve. But I'm just going to go ahead and place that there. You need to make sure that your gauge is positioned so that as you're taking the blood pressure, you can actually see the gauge. Okay. So now that that's on, the next step is to put your stethoscope on. And you want to put your stethoscope on last because you certainly don't want to hear all that rumbling, all that noise that you pick up as you're putting your stethoscope on. Now before you begin, you want to tap your stethoscope to make sure that it's working. Now you have two sides to your stethoscope, the pediatric side and the adult side. Make sure that you turn it to where when you tap on the adult diaphragm, that's the sound you're picking up. Okay? The last thing you want to do is to take a blood pressure cuff on the side that's turned off and not hear anything. Okay? So you want that to be working. Every now and then I'll have a student say to me, "I don't hear anything," and when I look at their stethoscope, it's because they had it turned the wrong way. Okay? So we're going to actually place the diaphragm of this chest piece over the brachial artery, where we felt that brachial artery, because that's really what we're going to be listening to. We're going to be listening to blood flow through that artery. So we're going to place this right over the brachial artery, and sometimes you kind of have to, work it under the cuff a little bit. But you want to make sure that the stethoscope chest piece is flush to the arm. In other words, you don't want to have it tilted So I don't know if you can see that, but you don't want to have it tilted. You want it to be flush to the arm. Okay, so you're going to have to make sure to get it in there and then press down. The next thing that I want you to remember is that you can't press down with your thumb like this. Okay. Theoretically speaking, your thumb has a strong enough pulse that when you're taking a blood pressure, you might hear your thumb pulse. And we don't want that to happen. We want to hear just the pulse that's coming through that brachial artery. Okay? Once you get that stethoscope on the arm, you need to secure it firmly so that it's not moving around. And you'll find out really quickly, the more movement you have, the more noise you're going to pick up, and that can throw you off as you're listening to blood pressures. Okay? So get that nice and firm. Holding the stethoscope chest piece down with 2 fingers like this. You want to hold it down like this. Remember, not like that, but like this. And it takes some practice to kind of find that spot. And again, don't forget that that has to go right over the brachial artery. If you're not sure where the brachial artery is at this point, or you forgot, you're going to need to feel for it again. Okay? On the other hand, you're going to take the bulb. This is called the bulb and the thumb screw. And what you're going to do is turn that screw all the way to the right. I don't know if you remember righty-tighty, lefty-loosey. But at this point, we want to have it turned all the way to the right. Don't turn it so far to the right that it tightens up. The last thing you want to do is to have to work really hard to loosen that, to untighten it. So just turn it all the way to the right until it stops. Okay? It's important that you do that because you're not going to get a good blood pressure reading. You're going to get confused if it's turned all the way on, all the way to the left. So turn it all the way to the right. Now practice, you're going to need to practice holding the bulb in the palm of your hand and operating the bulb with 3 fingers, but with your thumb and index finger, operate that thumb screw. Okay, so you're doing 2 things. You're pumping and turning this screw open. Okay, so now with the bulb in your hand and your fingers on the thumb screw and this thumb screw is turned all the way to the right, we're going to start inflating this bulb, which is going to inflate the cuff. Now, as the cuff pressurizes, the needle is going to start to rise. Okay, so if you'll just kind of watch the needle, I'm going to go ahead and inflate to about 160 psi, or mmHg actually. 160 mmHg, that's millimeters of mercury. So we're going to slowly increase it all the way to 160, and as soon as it gets to 160, stop and slowly open up your thumb screw so that the gauge starts to drop. And if you'll notice, the gauge is bouncing. While that gauge is bouncing, I'm actually listening through my stethoscope to the blood pressure sounds. Okay? Now the goal of taking a blood pressure is to hear the very first sound and to maintain that all the way until the very last sound. When you hear that very first sound, it's going to sound like dum, 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 dum. When you hear that very first sound, you're going to register or mark that on the gauge. So if the gauge happens to be at 140, 145, 120, that's where you have to mentally make a note that the first sound that I heard was at 140. Okay? And it's going to continue beeping as the gauge starts to drop down to 140, 138, 136, all the way down. You're going to listen to the very last sound. Now, wherever that last sound is heard, that's where you're going to mark it on the gauge. So let's say you hear it all the way down to 70. So you have 140 over 70. Those will be your blood pressure readings. It's important to learn how to control this gauge because you don't want the air pressure to release too slowly, or you don't want it to release too fast. If it's going down too quickly, if that needle is dropping too fast, you're not going to give yourself enough time to hear and to see that first sound. So it takes practice. You really have to practice opening and closing the thumb screw of the bulb and in listening for sounds. It's not easy in the beginning. It takes, and this is why we want you to practice at home. You should take your blood pressure cuff and your stethoscope and practice on as many people at home as you can. And if you're not sure what you're listening to, at least you're practicing using the equipment. And then when you come back to class, you can ask questions on technique and maybe have me watch you perform a blood pressure, and I can maybe critique your technique. Please remember that the blood pressure readings, when you're taking them manually, are always in even numbers. These gauges are calibrated in even numbers, not in odd numbers. So you should never have an odd number reading like 123 over 76. I'm sorry, 77. The numbers are always going to be in even numbers, like 122 over 78. Okay, that's just the way this particular system is calibrated. Other systems are a little more fine-tuned, and they can give you odd numbers, but not the manual cuffs that you have with you. Please don't inflate beyond 160 initially, and don't leave it at 160 for too long, because that feels very uncomfortable. That pressure hurts. So once you're ready to pump up your pressure, your bulb, pump it up to 160, open up that thumb screw to allow the air to slowly release, and start getting that pressure off the arm, because that can be very uncomfortable. One of the big mistakes that students make in class is that they take their reading and they just sort of guesstimate what they heard. I don't want you to do that. I want you to have accurate, concise, and actual numbers. If you're not sure what you got in that first reading, if you have any doubt, your only option is to take the cuff off, put it on the other arm, and take it again. Right? I don't want you to guess, because what I'm going to be doing in class is actually going around and taking blood pressures after you take them with the automatic unit. I'm looking for numbers that are really close. Okay? So please write down or remember to ask questions in class, and I'll try to help you as much as I can. All right, thank you.